Calibration, 2-minute anaesthesia and critical care. Monitoring devices are essential throughout anaesthesia and critical care. We are able to measure a range of factors including temperature, voltage and pressure, to name a few. These values usually come with a range of minimum to maximum. It is essential to ensure the value is accurate. One aspect to ensure this accuracy is calibration. The aim of calibration is to ensure the measured value is equal to the actual value, hence meets instrument standards. Measurement systems usually involve a sensor which can detect chemical, electrical and physical, i.e. pressure and temperature changes. A transducer may then convert one signal to another, i.e. pressure to electrical. The signal can then be modified and processed prior to display. Processing may involve amplification, which can increase the amplitude of the input signal. Specific amplifiers include the differential amplifier, which are able to perform an important step in reducing interference using a process called common mode rejection. The output signal can then feed back to the transducer and sensor. Now let's discuss accuracy and precision. Accuracy is the output value from the measurement system is equal to the actual value, while precision is the system's ability to reproduce the same value. A visual representation of both accuracy and precision on the dartboard is shown. Precision is represented by how close the darts are to each other, whilst accuracy is represented how close the darts are to the bullseye. Now we can discuss both accuracy and precision. The graph on the left is accurate and precise, whilst the graph on the right is accurate but imprecise. Please like and subscribe. Inaccurate data collection can occur due to multiple pathways. These include human errors, i.e. inaccurate interpretation of information, equipment dysfunction, and also random errors, which are unpredictable readings. Most measurement systems are not truly accurate. If this was the case, a linear relationship would exist between the measured and actual values. The linearity of a system measures how well the measured variable represents the true value. The first graph highlights offset drift, where there is a fixed deviation from the true value throughout the whole measured range. And as a result, only 1 point calibration is required. An example would be an arterial transducer. The next graph highlights gradient drift, where the deviation from the true value increases progressively. An example would be a BM machine, where 2 point calibration is essential. In this case, the BM machine would require 2 point calibration with 2 different solutions. Not all relationships are linear. Unlike linear relationships, non-linear relationships are not straight lines and therefore require multiple point calibrations. An example is a thermistor. Hysteresis describes a non-linear relationship, where the output reading varies depending on the input reading. Calibration is essential for both curves. An example of which is a thermistor, where electrical resistance is different at the same temperature depending on whether the temperature is increasing or decreasing. Static and dynamic responses. So a static response is no change over time, whilst a dynamic response, the input and output variables change over time. When we compare zero, first and second order systems, a zero order response, the output is proportional to the input, i.e. resistance wire. For first order response, the output is exponential manner to the input, i.e. a mercury thermometer. And finally, a second order response is oscillation around a point, i.e. an invasive blood pressure measurement system.